Surgeons at the Vein Center are showing us how easily veins can vanish by giving us an inside look at a sclerotherapy treatment. Here's Christy with more.
This is Miss Heike Smith. She has got a bad problem with some varicose veins, or actually spider veins, and with some minor varicosities below them. Many times spider veins are just very superficial, as we can see here, and the real cause of them we're not sure of. Just people develop them being on your feet for years, especially if you're in an occupation where you're on your feet a lot, this can be a problem.
This treatment is called sclerotherapy. Dr. Schneider injects a solution into the veins and it vanishes almost instantly. But that's temporary.
You'll see when we inject it, it's fairly dramatic in that the vein tends to go away immediately. It then comes back kind of with a vengeance, as I tell people, because what we're doing is causing an inflammatory response, and so your body then tries to clot this off and absorb it.
The treatment is done in a matter of minutes, and it's practically pain-free.
It is quick. Unless you have very extensive veins, it's a 10 or 15 minute procedure. It's basically painless, but depending on the number of veins that you get stuck, even that, just as small as that needle is, it's a 30 gauge needle. If you have to have 15, 20, 30 sticks, it begins to bother you after a while. So we try to break up the sessions to make it where it's not uncomfortable.
If you want great looking legs for next spring or summer, you should start the process now.
To really get the end result it's a 10, 12 week process probably. And so I emphasize that to people. They come in and say, I'm going to the beach next week. Let's see about fixing these veins. Well, that's not the time to do it. The bigger the veins are, the more blood you're going to have clot off in them, and so the longer it's going to take to absorb that. The little bitty spider veins, not so long, but the larger ones like she had there take a little longer. A lot of people come thinking we can use a laser on these veins. The laser works for real tiny veins on the face and tiny red veins. It won't work for blue veins, and certainly won't work for veins of this size. It's not too early to start, because if you're going to have a treatment, come back in a month, maybe have another treatment, and then take a couple more months. You're talking 3 or 4 months from right now, and so you're getting close to spring even now. So it's not too early to start now. So if you want to give somebody a present for Christmas, you can give them an early Christmas present and tell them to get started on the sclerotherapy.
For Tammy, the treatment is making a big difference. Her unsightly veins are vanishing.
It's as I tell people, there's no magic here. I wish we could, but we can't make your legs look like they did when they were 18. But it almost always gives a good result. Most people are very pleased with it. We have very few, there's not much in the way of complications that you can have with it. You can have some discoloration. You can even have skin slough on very rare occasions. But it's almost always a good result, and people are very pleased with it. All right, let's go ahead and put a wrap on that. We put kind of a pressure dressing on it now because we want to continue to have contact between the sclerosing agent and the vein walls, because what we're trying to do is make this thing scar shut, clot shut, and let her body absorb it. So we'll see her back in about 4 to 6 weeks and see how things are going.
The first 10 callers to the Vein Center at 615-269-9007 will receive a free consultation. The Vein Center has 2 convenient locations. You can find them in Franklin at 125 Cool Springs Boulevard in Suite 250. Give them a call there at 615-503-9895. They also have a location in Belle Meade. That's at 4535 Harding Road in Suite 304. You can reach them there at 615-269-9007. And for a link to the Vein Center's website, go to betternashville.com.